Hi, my name's Dan White. John's asked me to talk a little bit about avoiding knee injuries while stepping from back stance and also from front stance. He's asked me to do this because I'm a personal trainer. I teach flow fit and tack fit and club yoga also. So when I step forward from Koko to Datch, we were talking about medial in general. Knee damage by rolling the knee in as you're stepping fast. From my point of view, this is due to that rotation when you have your weight bearing. As I step, instead of pushing off my back knee and rolling my knee in, I want to squeeze using my core and step forward. You get injured, you hurt your knee, one by not having correct hip joint mobility and knee and ankle, but by having too much weight on your back leg and rolling in. If you've transferred your weight forward, this amount of rotation doesn't cause injury in a healthy knee, but we don't get to that point. We transfer the weight forwards and pull before you step forward for your next back stance. So the same thing happens whilst throwing Gakuzuki. If your stance is too long for your hip mobility, when I punch Gakuzuki, I actually get rotation of my knee, and you see this a lot. If I can shorten my stance and I can squeeze my knee in and point it forward, so this is where my hip mobility comes in. If my hip is tight, I can't angle my knee point forward properly. And then when I punch, there's no rotation of my knee, just extension. The other thing when we're stepping in front stance, your body finds the path of least resistance. You want to move quickly. Quite often, and it's been posted about before, people will rotate their foot out to collapse forward rather than just like our back stance, squeeze to push forward. The change in angle of my foot occurs at the end of the step, not at the start of the step. So I squeeze and then it twists at the end if it needs to. But you don't want to rotate out because then we have that same collapsing in as we do on our back stance. So it's exactly the same mechanism of injury. You're putting a lot of stress on the inside of your knee.